Male pattern hair loss affects a large majority of men, anywhere from the ages of 20 all the way up to 50 plus. And up until now, the gold standard to prevent or slow down the hair loss has been finasteride. Oftentimes, many of our patients do not wish to take finasteride orally because of the potential side effects. Albeit very small, they are concerned about the possible sexual side effects and also side effects to muscle mass and mood. Up until now, we've only been able to compound finasteride into the topical form in an alcoholic base. Now, one of the problems with injecting finasteride in an alcoholic base into the scalp is it's going to cause an immense amount of irritation and sometimes even hair loss in itself. Well, our prayers have finally been addressed, and I'm happy to say that we have a patented form of finasteride in a lipid base. Now, what this means is when you come in for your microneedling P.R.P sessions at our clinic, we will also paint a base of the finasteride in a lipid layer and microneedle this into your scalp. So in essence, if you are a patient who is not willing to take finasteride orally due to the potential side effects, we can now offer finasteride in a microneedled format in a stable lipid base, which will stay in your scalp, and the concentrations in your blood will be far lower than the oral medication, and therefore the risk of side effects will potentially go down. We use this in combination with P.R.P injections, and we've seen very promising results from our cohort of patients. So you can book the appointment by calling our clinic or leave us an email. Thanks very much.